You may have heard that the American Board of Surgery has introduced a new assessment model called Entrustable Professional Activities, or EPAs. It was first rolled out for general surgery residency programs in July of 2023, and other specialty and fellowship EPAs are coming soon, beginning with vascular surgery in 2024. So what is an EPA? Entrustable professional activities are clinical tasks or responsibilities that can be delegated to a trainee after they've demonstrated sufficient competence. Using EPAs as an assessment framework, attendings observe trainees performing real workplace-based activities and then make decisions about whether to entrust or not entrust responsibilities to them as their skill level increases. The Board of Surgery has defined 4 levels of entrustment. Trainees may start at a level of limited participation, progress to performing an activity with direct supervision and then indirect supervision, with the eventual goal of achieving an entrustment level of practice ready. After observing a trainee perform an EPA, the attending and the trainee each use a mobile app to log an entrustment-based assessment score. The app provides helpful descriptions of what different entrustment levels might look like for each EPA, as well as a place to log case complexity and written feedback, which can be dictated into the app. Logging an assessment takes only a minute and must be done within 1 week to ensure the assessments are timely and accurate. Both trainees and attendings can initiate an assessment. The app allows both trainees and attendings to view a trainee's prior scores in order to plan goals and expectations for future interactions. Your program faculty can also use this data as part of their semi-annual clinical competency committee meetings to help inform summative evaluations of trainee performance and decisions about progression. Ultimately, the greatest value of EPAs is to encourage conversation between attendings and trainees. It empowers learners to get real-time feedback and ask questions like, what do I need to work on that would allow me to do this task more independently next time? Since 2018, the ABS has been piloting and drafting EPAs in general surgery and has released a list of 18 core EPAs for graduating general surgery residents. Similar lists of EPAs are being drafted for each of the different ABS certified specialty programs. The EPAs encompass a foundational set of behaviors, procedures, and skills that all trainees should be comfortable performing by the end of their surgical training. Furthermore, trainees are assessed holistically across all phases of patient management, with most EPAs being further broken down into a preoperative, intraoperative, and postoperative phase of care. You may be wondering at this point why the ABS has chosen to pursue this initiative. It may help to understand that the ACGME and the ABS have been using other metrics of competency-based assessment since the 1990s. Initially, they developed the core competencies, which were later honed into milestones. Both of these frameworks are still currently used in evaluating residents. The problem, though, is that milestones and competencies were designed with summative evaluation in mind, such as at the end of a rotation or end of an academic year, and they focus more on conceptual goals. They don't always translate into day-to-day clinical behaviors. As a result, EPAs emerged as an assessment framework based on the assortment of clinical activities that trainees already do in their daily clinical workflow. By formally recognizing these clinical learning opportunities, and based on data from other countries where EPAs are already in use, the ABS expects to achieve a number of potential benefits in surgical education. We believe EPAs will encourage frequent, unbiased, and actionable feedback that is useful to trainees in real time on a day-to-day or week-to-week basis. Because trainees have their own data to review with attendings before performing an operation or other clinical task, EPAs will empower trainees to progress towards autonomy earlier, even with attendings they may not have worked with recently or may not be as familiar with. They will help identify struggling learners earlier in training, and eventually, EPAs may enable learners to progress through training based on competence rather than traditional or more arbitrary metrics, such as weeks and years in training or number of cases logged. We know that not all trainees progress at the same rate. Some may need more time or repetition, and some may need less in order to achieve the same level of competency. The EPA framework may eventually replace traditional models of progression and allow for flexibility to fit the needs of individual learners. If you are interested in learning more about EPAs, please visit absurgery.org and click the EPA tab for a full description of this project, including access to FAQs, recorded webinars, scholarly articles, and more.